When you apply the Mepilex transfer to an area, it's designed to literally wick the drainage away from the surface of the skin and into a secondary dressing that you may be using to cover the transfer. In theory, then, what you can do is just replace the cover dressing that's covering the transfer and leave the transfer in place. Wound healing, it's best to leave the wound alone for as long as possible to permit the wound to heal and to not disrupt any healing process. So a good combination, particularly in the winter, may be using a transfer, and if you've got a highly draining wound, cover that transfer with an ABD pad or an abdominal pad. They come in a variety of sizes, and so you can leave the transfer in place and then just change the ABD pad or the abdominal pad as frequently as need be, depending on the amount of drainage it's absorbing. Okay, the next dressing that we're going to talk about, actually I'd like to go back to the Mölnlycke, because they have a variety of foams that we've not talked about. There is the Mepilex, the regular Mepilex, which is thicker and designed to absorb more drainage, and it comes in a variety of sizes, such as your 4x4, your 6x6, your 4x8, and your 8x8. Then there is another dressing by Mölnlycke called the Mepilex Light. Mepilex Light is a very low profile foam. It's not going to absorb nearly as much drainage as your regular Mepilex, yet it will absorb more drainage than the transfer. The light dressing comes in a variety of sizes, 2.3 by 3.4, 4x4, 6x6, and a 8x20. These are all in inches. The light will absorb more than the transfer, but again, the light is not going to be very effective on a wound that's moderately draining or heavily draining. The transfer is used a lot with those who have recessive dystrophy. The Mepilex Light is used primarily for those who have simplex or dominant dystrophy. Then there is, Mölnlycke has Mepilex Border dressings. Mepilex Border, since it does have a silicone impregnated border, it will, and it's a little thicker than the light and the transfer, it is a dressing that will remain in place because of the border, so you might want to try that. I do have recessive dystrophic individuals who do use the Mepilex Border as well as the Mepilex Transfer. Then there is Mepilex Border Light. Mepilex Border Light is a very nice dressing. It's very low profile. It's thinner than the Mepilex Border, and it comes in a variety of sizes of 1.25 by 0.75 inch pad. It comes in like a Band-Aid size. The overall size is a 5x3, and it comes in a 3x3 and a 4x4. The Mepilex Border Light is primarily used for individuals who have simplex or dominant dystrophic. The reason why it's primarily used for those types of wounds is because the Mepilex Border Light tends to be tackier, stickier, and a little more aggressive about adhering to the skin. So it doesn't do well on recessive dystrophic individuals. But it's a very, very popular dressing with those who have simplex or dominant dystrophic, or in some cases, a junctional non-Hurlitz patient. Okay, the next one we bring up is the Hollister Restore. It's by Hollister. Super absorbent foam. It vertically wicks drainage, protecting the surrounding skin from breakdown. The Hollister Restore product, it has a contact layer attached to it. And the contact layer is a non-stick, non-adherent layer. And they use the Triac technology is what's impregnated in that contact layer are three products, that being Tri. The contact layer is impregnated with particles of hydrocolloid, particles of petroleum, and particles of hydrogel. And this truly is a very good non-stick, non-adherent foam. And as you see on the screen, upon contact with drainage, protective gel foams allow a virtually pain-free dressing change. The Hollister Restore foam comes in a variety of sizes. It comes in a 4x4, a 6x6, a 6x8. And now Hollister also has a similar to the Monolink Meplex Lite, and it comes in a variety of sizes. Off the top of my head, I'm not remember the sizes that the Hollister Lite comes in, but it's a very effective dressing, and a lot of my simplex and dominant dystrophic like the Hollister Lite foam just as much as the Monolink Lite, or the Restorer Lite, or the Meplex Lite. Okay, the next foam we're going to talk about is Polymem. Polymem is a pink foam. It also comes in silver. But Polymem is a foam that's impregnated with glycerin and a cleansing agent called SureCleanse. And they promote Polymem as a self-cleansing foam. And actually what they do is they recommend that you really don't even have to cleanse a wound. You go and when you go do a dressing change. And what you'll find with Polymem is when you initially use the Polymem, you will see an increase in drainage. And what the Polymem is actually doing is it's wicking toxins and things that shouldn't be in a wound out of the wound and into the foam. But after you use the Polymem for several days, you will notice that the dressing, the drainage actually will begin to decrease. And the Polymem is a very effective foam, and it will help to reduce pain. It's been known to reduce pain. And it's a foam that you can use by itself without any topicals. You would never want to use any topicals with the Polymem foam. There's a variety of stories I could tell you, but I'm not going to go into those now. But Polymem I've seen cases where Polymem has actually healed chronic wounds, where wounds have been chronic for a long, long time, and the use of Polymem actually helps to close chronic wound. It's a great dressing, and it comes with borders, but I don't really recommend borders unless, again, you have simplex or dominant dystrophic, where your skin can take a little more tackiness than those who have junctional or recessive dystrophy. It's a nice foam, and it comes in a lot of sizes, a 3x3, 4x4, 5x5, and it's becoming very popular, more popular in our EB community.
We notice on the presentation the picture does not appear. The foam is basically a pink color, but Polymem, just keep that name in mind.
Another foam that I'm going to bring to your attention is a foam that's been around for a while, but I've really not thought much about introducing it to the EB community, but I thought I'd bring it up today. It's called Hydrofera Blue. You take the Hydrofera Blue out of the package, it feels hard and firm. It feels like a piece of bark. Now, this foam, you must wet it with saline or water. And that's the only way you can use it, because you have to soften it up. But it will absorb drainage, it will control odor, soft when you wet it, and it's comfortable, but it is an antimicrobial foam. I'm not going to read all the information as to what's in that foam, because I can't pronounce most of what's in it. But it is very aggressive about dealing with bacteria. As you can see there, MRSA and VRE. So, again, if you go online and you look up Hydrofera Blue, I'm sure you can read incredible stories and what it has done to heal chronic wounds that are highly infected with a large amount of bacteria. It's something you may want to try. Again, I'm not sure of the sizes off the top of my head, but I think we have it in a 4x4 and a 6x6. 6x6 may end up being the largest size that we carry. But it has proven to be somewhat effective with a high bacteria count wound.
One thing to keep in mind in utilizing this dressing, it has to maintain and be moist.
Yes.
So you would not want to, you'd want to wet it before you put it on and maintain that moist environment with it.
And again, you don't want to use this type of a dressing just for protection. You would want to use it on an infected wound. All right, next we're going to talk briefly about contact layers. Stygenix has brought out a new product called Adaptic Touch. This is very different from Adaptic. Sure, many of you have used Adaptic and many of you don't like Adaptic. If this is Adaptic Touch, it's impregnated with silicone. Its features and benefits are it's a comfortable silicone dressing. It promotes automatic removal, conforms to the wound area, has a mesh design. Now the mesh design, the holes are not as large as you may find. It doesn't seem to be quite as moist as the Mepitel, but it's a smaller mesh as you see, and it's not adherent. It's considered a contact layer, and it's becoming somewhat popular. People are willing to try it, and there are those who like it very much. But it's a contact layer, not adherent, and you can use it as you would use it as a primary dressing. You would never use it as a secondary dressing. And again, since it is a contact layer, you need to cover it with something with another dressing, whatever it may be, a foam or an ABD pad.
So are you able to cut the Adaptic like you are some of the other contact layers?
Yeah, you can, of course, but you might want to. I don't see a reason why you'd want to cut it. So, yes, you can cut it or not cut it.
Okay. Wow. Hello, everyone. This is Christine again. A big thank you, first of all, to Danielle and Bill for helping to explain some of these key product categories. Now I will open up the forum for questions. I know we already have a few. To ask a question of Danielle and Bill, please click on the hand icon to raise your hand. When I see your hand raised, I will call your name. Once your question is asked, please click the hand icon again so that we can move on to the next question. The first question, I believe, is from Jamie. So, Jamie, I'm going to unmute your line. Okay, Jamie, do you want to go ahead with your question? Can you hear us, Jamie?
Can you hear me?
Now we can.
Hello? Sorry. I find the Meta Honey in the tube really helpful in terms of healing a very slow wound. But if I use it for like more than a week, my son breaks out in a rash. I don't know if other people find this, and if so, what's causing the rash?
Is it too moist? Is it making the surrounding tissue too moist?
It actually dries up the wound, which I think is what helps it. And for like the first week, it's completely fine, and then I find it almost looks like a yeast rash.
Surrounding the wound and not necessarily on the wound?
Not on the wound at all, but just like within like a 3-inch area around it.
Well, I really can't answer that question, but in my opinion, I would, at that point in time, you should, I'm sure, and you do,
discontinue.
Discontinue.
Yes.
Right.
Yes, and the rash goes away within like 2 days.
Yeah. Well, I have no idea why the rash happens, but as long as you're accomplishing your goal by healing the wound or drying the wound up, then at that point, yes, you're doing the right thing.
Okay.
Discontinue using the honey. Don't quit using the honey altogether. You're just gonna have to watch it very closely.
Yeah. Okay. Thank you.
It might be some allergic issue. I don't know.
Okay.